Hello there. My name's Dr. Ron Daniels. I'm an NHS intensive care consultant working in Birmingham. I'm also the founder and chief executive of this charity, the UK Sepsis Trust. And we're going to talk today about sepsis in the context of COVID-19, but also talk about severe infection. The first thing to say is that this is, of course, about people. It's about human beings. It's about their stories. The reality is that sepsis affects around 9 times as many adults as it does children, but there are risk groups in both adults and children. And one of the easiest ways to encapsulate the risk groups is it's the extremes of age. So very young children, particularly those under 1, but less so those under 5. Also older adults over around 65 years of age. But anyone with chronic conditions like diabetes, cystic fibrosis, anything like that, they're also at increased risk of severe infection and sepsis. My story starts with Jem. Jem's on the left here. He was 37 when this photograph was taken, and he was 37 when he died 2 weeks later on my intensive care unit, leaving his widow, Karen, and their 2 young children, Tom and Emily. They're standing on a bench in the photograph. Jem was fit and healthy. He had no problems. He had a vasectomy in the community and began to become unwell. And Jem's story really revolves around the fact that Karen and his broader family weren't empowered to ask of health professionals, could it be sepsis? They'd never heard of sepsis. And health professionals sequentially assessing him failed to take a full set of observations and failed to give Karen really detailed instructions around what to do if he got worse. So he progressively deteriorated over several days at home. He arrived in my hospital in cardiac arrest, and thereafter we failed him as well because we resuscitated him, but we didn't think sepsis ourselves. And so it was another 7 hours before we thought to give him what might, had they been given earlier, have been life-saving antibiotics. So I watched Jem die. And I told Karen that Jem was going to die, and I knew she was going to have to go home to tell Tom and Emily that Daddy was not coming home. And it was at that moment, it was that episode of care that resolved me to start to do something about it. And one of the first things we did was to start to look at how we define it. Now, Jem died in 2005. It took 5 years for us to get an accepted international definition of sepsis. And this is it. This is called the Marinoff definition. And we coined it in New Jersey in 2010. And it says that sepsis is a life-threatening condition. Of course, I think we all get that. And it arises when the body's response to infection causes organ injury. Now, that's really important because this doesn't have to be a serious infection. People can get sepsis as a consequence of a pneumonia, a urinary tract infection, or even something as simple as a cut or a bite or a sting. But the key point in sepsis is it's the immune system going into overdrive. And if we don't stop it, whether it's an adult or a child, that starts to cause organ damage. Jem was an Aston Villa fan, and he was probably here on the day this photograph was taken because he was a season ticket holder and went to pretty much every home game. But at capacity, Villa Park holds around 43,000 people, and that gives us some interesting context. Because breast cancer, and it's right and proper, we continue to strive to improve outcomes from breast cancer, claims around 11,000 lives every year. Bowel cancer is rather more, which might surprise some. That's 16,000 lives lost every year. But sepsis every single year in the UK claims 48,500 lives, which is more lives than are claimed by breast cancer and bowel cancer and prostate cancer put together. This is enormous. I mentioned that we would also talk about infections that might give rise to sepsis, if you like, severe infection defined by the need for hospitalization. Now, these are adult data, but I will describe the picture in children. In adults in rich countries, 4 sources of infection give rise to the vast majority of cases of sepsis. Pneumonia is about half of cases, and then urinary tract infection, intra-abdominal infection, that's things like appendicitis or burst ulcers, and then skin, soft tissue, bone and joint infections. That's things like septic arthritis, where a joint becomes infected. It might be as simple as a cut or a bite or a sting that gives rise to cellulitis. So together, those 4 sources of infection in adults account for 95% of cases of sepsis. In children, meningitis only accounts for 10%. And our friends, the meningitis charities, have done brilliant work over the last several decades, raising parental awareness of meningitis. But the harm from that, or the potential harm, and in fact, it's actual harm, because we do have parents telling us that they were falsely reassured when they looked for a rash and it wasn't there, is that half of kids who die from infection die as a consequence of a pneumonia precipitating sepsis. Abdominal problems are less common. Skin and soft tissue slightly more common than in adults, and UTIs, they're pretty unusual in kids unless there's some abnormal anatomy going on. But it's important that we remember that meningitis is but a minor cause of serious infection and sepsis in children. I'm not diminishing it. It's important that we look out for it, but we need to start to teach parents to look out for other infections in the context of a child who's deteriorating. In terms of how many people are in hospitals in England every year with one of these conditions, we started to look at these things. These are hospital episode statistics. Now, they're enjoyed by statisticians. They're pretty dull to anyone else, but these are the codes that really define those 4 types of infection. And you might be surprised to learn that 1.7 million admissions to hospitals in England in 2017 were complicated by one of those infections. So they were either admitted with one of those infections or they developed one in hospital. So we've got a huge number of people every year suffering infection that requires a hospital stay, intravenous antibiotics, and which might give rise to sepsis. This is 1/3 of acute sector NHS workload. Globally, I think it's really important we understand global data because this is where children really are impacted. It's 49 million, and these data came out just before the pandemic hit the West. 49 million people develop sepsis every year, and 11 million people die. And half of those lives lost are children under 5 in resource-poor countries, most commonly as a consequence of diarrheal disease. But again, it's not the diarrhea that tends to kill the children. Of course, some of them do die of dehydration. It's sepsis. It's the body's immune system overreacting. It's the multi-organ failure that is caused. So getting things right in a rich country like ours can then allow us to learn lessons from that learning and apply that learning to resource-poor environments and save many thousands of children around the world. And indeed, we in the Global Sepsis Alliance are working very closely with governments in Malawi and Bangladesh and other countries. Here's what that looks like in, again, the context. So sepsis, death from infection, claims more lives every year around the world than cancer, than ischemic heart disease or heart failure, and claims 2.5 times more lives every year than COVID-19 has thus far claimed during the entirety of the pandemic. So COVID has really shone a light on infectious illness and the danger of infectious illness, but the reality is it's always been there. These data prompted the WHO to issue a call to action to governments around the world, and they did this in September of 2020. And they reminded us that sepsis accounts for 1 in 5 lives lost worldwide and called governments to act by raising public awareness, by strengthening healthcare systems, by improving access to vaccination, clean water, sanitation, and hygiene. And I would suggest we've got an opportunity now. We have a public who've never been more engaged in their own health with relation to infection ever. This is just an example. This is a short video I did on social media, on Twitter, and it was seen more than 400,000 times, not by health professionals, but by the public. It was simply explaining why we tend to ventilate people with COVID-19 prone on their tummies. So there's a thirst for knowledge, and we need to harness that. We need to remind our public that infection from other bugs, other pathogens, is equally important to infection with COVID-19, that vaccination remains important, and that early access to healthcare remain important. COVID causes sepsis. That's really clear. This was published in one of the major medical journals. This was colleagues in Wuhan, and they made the point. This is viral sepsis. It's the body's reaction to the virus, which is sending the immune system into overdrive. And in the most seriously ill people in hospital, this is viral sepsis. A good friend of mine called Jean-Louis Vincent, who works out of Belgium, he's a professor of intensive care and he heads the European Society of Intensive Care. And he wrote this little article, and we don't need to go into the science, but he said, COVID, it is all about sepsis. And he said, well, is this semantics? Are we just being opportunist calling COVID sepsis? And no, he argued that it explains why the treatments we use in intensive care are effective and the ones we no longer use are ineffective. So we don't use antiviral drugs in intensive care for people with COVID-19 anymore. They don't do anything because it's not an overwhelming viral infection. It is sepsis. We do use steroids. You'll have heard about those. And we also use antibody therapies because they damp down the immune system and they save lives. This is sepsis. We don't need to labour that point, but I think we do have this opportunity. And I co-wrote this paper in, again, one of the academic journals. And we said, if we don't learn lessons from this pandemic, both in terms of future pandemic preparedness and planning, but also in terms of the attention we apply to life-threatening infection in the same breath as antimicrobial resistance and in the same breath as infection prevention, then we will have failed our public. So far, I've talked about life and death, but the reality is there is a burden of survival. And this holds whether the survivor is an adult or a child. And I don't have a photograph, which is remiss of me because I've got permission to use a photograph, but there's a lovely couple of twins. They're now 7 years old. And one of them developed sepsis. So Tilly had sepsis. Her twin sister Lucy obviously didn't have sepsis. They were identical twins, are identical twins. But thankfully, Tilly survived. It was touch and go. You can read about a story if you follow on social media, Knackered Mum of 4. But Tilly survived, but is developmentally behind her identical twin sister Lucy in every regard. So academically, in terms of her physical ability, she's just a little bit weaker and a little bit slower, obviously through no fault of her own. But it illustrates that survival can carry a burden. She had sepsis as a baby. She's still struggling 7 years later. And this is true across adults and children. About 40% of people who survive sepsis have one or more of these problems. So we describe them in medical terms as physical. Now, that can be just weakness and fatigue, but it can be loss of limbs, loss of digits, and that includes in children. Cognitive. Now, we might have heard of the term brain fog to describe the after effects of COVID-19, and that is really real, but it's existed for decades, in fact, millennia, with people with sepsis. We know that poor concentration, poor judgment, poor decision-making, that affects people affected by sepsis. And psychological, ranging from relatively minor, perhaps mood swings, perhaps minor sleep disturbances, through to PTSD in around a fifth of survivors. In this study, and this was quite a small study, it was done in Denmark, and it looked at working age adults who'd survived sepsis, and it found that only 57% of them were back at work at 1 year after their illness. So there's a massive effect on the families as well. Mindful of this and mindful that long COVID is identical pretty much to post-sepsis syndrome, we opened up our support nurses' doors. So that's one of the 3 functions of the charity, is providing support to people with peer-to-peer support, with support networks and groups, and telephone and email help. So our support nurses have been treating people affected by COVID-19 as well as sepsis caused by other bugs over the last now 16, 17 months. And we have learned that it is almost an identical syndrome, which is not surprising. It's the same pathology. It's the immune system going into overdrive. We also know that people who've survived COVID end up back in hospital. So this was a big study between London and Leicester and the Office for National Statistics, and it found that a third of people who had been discharged from hospital with COVID ended up back in within a few months. It didn't tell us why, but this American study did. And this was a smaller study, but it identified that in around a third of cases, it was because their COVID got worse. But in 10 or 11%, it was because they developed bacterial pneumonia and sepsis as a consequence. So we need to educate people who've survived COVID around the risk of sepsis. The second function of our charity is around the provision of clinical tools. And I'm just going to share these with you, mindful that not many of you are clinicians, some will be, but mindful that not many are clinicians, but just because it illustrates the complexity of recognizing sepsis in children, but also the opportunities for recognizing sepsis in children. So this, again, is a tool for clinicians. So we don't expect the language to be entirely familiar to everyone, but we start the chart if the child's physiology is abnormal, their vital signs. Now, many parents have access to pulse oximeters. Many parents can measure a breathing rate just by counting and looking at a watch. Many parents might have a blood pressure machine at home, but we need to be careful that they're age appropriate for that child. Otherwise, they give dodgy results. But thinking about vital signs, thinking about, does my child, or does this child that I'm caring for, that I'm advocating for, are they behaving abnormally? Do they look like they're breathing fast? Are they behaving? Are they able to move as normally as they would be? We come on to qualifying it in section 2 with could it be due to an infection, but then we look for red flags, and these are the red flags for health professionals. So a child that doesn't wake when aroused or won't stay awake, that's really important. And for health professionals, that is a red flag. So a child that's really behaving abnormally, looks very unwell, is moaning, is groaning, is simply out of sorts, they might have sepsis. And those cues, which are not based in blood tests, they're not based in something concrete we can measure, they're just human instinct, empower health professionals to start treating sepsis. So those cues can empower people who aren't health professionals to also ask for help. So the critical point is around children who either look abnormal, so they might have very pale skin, their skin might be cold to the touch, so they might feel abnormal, they're behaving abnormally, they're not interested in things, they're very drowsy, and they might have some other symptoms and signs like high respiratory rate and so forth. And we'll talk about symptoms in children shortly. But I'm only showing you this to reinforce that there's no magic in health professionals identifying sepsis. It's simply using, as well as the vital signs, the human instincts that we all carry and we all have. And of course, vital signs vary with age between children. So very young children will tend to have a higher breathing rate and a higher heart rate than older children. Now, no one is asking non-clinicians to carry any of this information around in their heads. But the important thing here is that a parent or someone advocating for a child knows that child better than I do, better than any health professional does. And it's really important that we trust our instincts. So we can look at breathing. We can, if we know a child, we'll know whether that breathing rate is abnormal for them. We'll know whether that behavior is abnormal for them. Obviously, some children are more prone to be a bit grumpy and lie on a sofa than others. If the behavior is abnormal for them, then that's important. And we need to start to think about sepsis. What we then do in hospitals is, of course, we get a senior clinician on their way to the sick adult or the sick child. We give them oxygen if they need it. We send a load of blood tests, basically to look for how their organs are working. We give them antibiotics, and even people with COVID-19, a lot of them end up on antibiotics because they tend to have bacterial infection as well. We give fluids into the circulation and we monitor the patient. And we've achieved huge inroads across England prior to the pandemic. These are data from hospitals that are reported into NHS England, and they show that before 2016, only 30% of people, and this is adults and children, and this is all through hospitals, this is not just emergency departments, 30% of children prior to 2016 had antibiotics within the first hour, which is a life-saving intervention. It's now more than 80%, and that's really important. And the mortality rate from sepsis has improved over time. Now, these are adult mortality rates. Children's mortality rates, you'll be grateful to know, are much lower than this. They're somewhere between 1% and 5%. But adult mortality has reduced during that same time period, showing that if we get the basics right, get these people into hospital, adults and children, in a timely fashion, treat them rapidly, particularly with antibiotics, then we save lives. And we do so without overusing antibiotics. And again, I don't want to get too technical here, but I've highlighted two columns in this data table. Now, these are data from the Royal Pharmaceutical Society in England. The left-hand column shows that since we started doing things, which is the yellow row, the yellow bar, the use of antibiotics in emergency departments has increased. And in fact, it's doubled. It's gone up by 103%. Now, on the face of that, that could be alarming because that's got potential negative impact on antibiotic resistance. But if you look at the right-hand column, total hospital use of antibiotics barely changed. It increased fractionally by 1%. So what this means is that it's possible to put in place clinical programs that encourage health professionals to give antibiotics early. We change the geography of where antibiotics are given. They're more commonly given in the ED, but there's no adverse consequence. We're not increasing total antibiotic use, and that's really important. So the first thing the charity did, which I described, was provide support to people affected, The second thing is provide these tools, these resources to health professionals to allow them to spot sepsis, to allow them to treat. And our tools are all formally endorsed by NICE. And then this will lead on to the third important step the charity does. It's around bringing our public on board. We wrote this piece in one of the academic journals after the World Health Organization adopted a resolution on sepsis in 2017. And we asked the former Chief Medical Officer, Sir Liam Donaldson, to write a foreword to that piece. And he said here some really important clinical issues. Some of them a matter of life and death, essentially live in a backwater. And you get some academics involved and you get some local enthusiasts involved, but change doesn't happen on a national or international scale. And Liam said, the way to do that, and of course many of us know this, is to get these things into the public and political space. And that's where an advocacy organisation like a charity can come in. Now, we're small. We don't have a marketing budget. We don't pay for any advertising, but we do have the ability to design relevant, responsible clinical messaging and form relationships to use available advertising space. So this is one example, big shouty yellow vans driving around our roads. They're very good reminders of the importance of sepsis and the symptoms of sepsis, more on which in a moment. Out of hours doctors' cars, again, we've used those spaces. And again, this is pro bono. And we work with advertising in city centres. We're donated space by some of the big providers of such space. And you'll notice that the messaging in non-clinical space is different. So on an ambulance, we talk about the symptoms. We talk about how important it is to act quickly. It's much softer in a non-clinical space. It's more empowering. It's hopefully less threatening. And it just reminds us that if an adult or a child is deteriorating with an infection, and particularly if you've never seen them this unwell before, phone 111 and just ask, could it be sepsis? We work with various sports clubs. This is Liverpool. We've interestingly also worked with Everton during the same season. We work with television programs. So we place, this is posters on BBC's Holby City. We place newspaper and glossy adverts. Again, this is all donated space. This was a campaign we ran earlier this year, reminding people that the lines between sepsis and COVID are blurred and they need to be aware of both conditions. And we also need to engage young people. And there's multiple strategies that we can use to do that. One is to play stories of sepsis affecting young people. Now, this little actor, Kieran Bowes, brilliant little actor. He's actually 13 now. He was 11 when his character had sepsis, but his character was only 7 when he had sepsis. He cut his knee playing football, developed life-threatening sepsis, ended up with an amputation to save his life. 8.1 million people saw that story. And we have dozens of reports now from parents who have acted when their child was unwell because of that very same story. So storytelling saves lives. It reinforces knowledge into people's minds and it saves lives. Just this last month, in fact, we've worked with Bristol Grammar School. Now, we can't release details of it, but tragically, they lost a pupil on a school trip. So what we've now been working on is the national guidance for the OEAP. This is now embedded in national guidance. It links to some videos we've produced about how to spot sepsis in children and young adults, which really revolves around trusting your instinct as someone who knows that child better than the health professionals. And it raises awareness of the symptoms to get these symptoms into the hearts and minds, really, of people advocating for children. We also have our Schools Against Sepsis programme. Now, this is currently designed for Key Stage 2. It's supported by Iceland Foods, the frozen food retail people. They have been absolutely brilliant in this because their finance director tragically lost his father to sepsis. So they've now put sepsis messaging on milk bottles, not 1 or 2, 95 million milk bottles on breakfast tables carrying messaging around sepsis. They've supported us developing the Schools Against Sepsis programme, and they've supported us sharing these symptoms. So there are different symptoms to adults and children. Obviously, they're slightly different beings. The symptoms in children, which is what we're really focusing on today, these are the symptoms that should empower parents, carers, advocates, teachers, whatever, to act if a child is unwell. So if the child is breathing very fast, which we've mentioned. If they have a fit or a convulsion, now most parents wouldn't need a card to tell them that if a child had a fit or a convulsion to seek help, but it's in there. If the child has mottled, bluish or pale skin. So this is not just about that meningitis rash. This is about most different types of skin discoloration. If they do have that rash, of course, that's important. If they're very lethargic, we've described, or very difficult to wake, or they feel abnormally cold to the touch. Now, this is Public Health England supported messaging, and the message you can see very clearly. It's go straight to A&E or call 999 if you can't get yourself there. There's videos in it. It wouldn't play, so I'm not going to labour the point, but it's supported by the TV medic, Dr. Ranj. It's narrated by the Hollywood actor Warwick Davis, because his wife very recently had sepsis. And it includes a full lesson plan. It includes engaging children around a responsible attitude to antibiotics, around the importance of healthy eating, sanitation and hygiene, but then around how they can disseminate this messaging to their peers. And this little monkey it's obviously a drawing, but it was depicting the favourite cuddly toy of a little boy called Sam Morrish, who died when he was 3 years old. So this is a tribute to Sam. The other thing we're doing is to engage organisations. So these might be large businesses. We encourage them to be sepsis savvy. It might be large businesses, it might be individual schools, it might be youth groups, scout and guide groups, for example, it might be other community organisations. We have a suite of free resources. Again, this is supported by Iceland Foods. They're a brilliant company to work with. It comprises an online video. It also comprises a simple online game for people to play. It's absolutely free. You can go just search Sepsis Savvy on any generic search engine, and it will direct you to our web pages where you can just sign up and download the resources for free. That's all I wanted to say. I'd like to thank everyone for listening. I'd like to partially apologise for including some clinical content, but I think it is really important that we understand what happens to these children and adults when they get to hospital. And I would really urge you to get out there and spread the word. Thank you very much.